Thank you for the invitation to discuss lupus in men. I'd like to discuss this issue by answering a series of questions. The first question is, how common is lupus in men? Well, lupus can occur in anyone, in men or in women, and in all races and ethnic groups. During the ages of 15 to 45, women are affected more than men in a ratio of 9-to-1. Or another way of thinking about this is that for every 100 individuals with lupus, 90 will be women and 10 will be men. In underrepresented populations, they get lupus more often than other groups, and this can occur whether you are a man or a woman. The second question that I would like to answer is the following. Are there differences in lupus between men and women? Worldwide, many groups are trying to tackle this question, and there are mixed answers. However, the most consistent observations are as follows. Men may have lower blood counts, more cardiovascular complications such as a heart attack, may be more likely to have unexplained fever and weight loss. They may also have chest pain, especially when they take a deep breath. Men seem to be older at the time of diagnosis than women. They may also have more antiphospholipid antibodies, which leads to an increased risk of clotting of the blood. In contrast, women may have more joint pain, hair loss, sun sensitivity, malar or butterfly rash, sores in the mouth, also known as oral ulcers, and Raynaud's phenomenon, which is when the hands turn colors when they're exposed to the cold. The third question I would like to answer is the following. Are the symptoms more severe in men compared to women? Again, there is no clear answer here, and we get mixed reports. Some centers report more kidney problems, and especially more severe kidney problems resulting in renal failure or kidney failure requiring dialysis or transplant. Other centers report an increased risk of death. Clearly, we need more research to understand these observations. The next question that I would like to answer is the following. What are the concerns about fertility in men who have lupus? Most of what we know about using medications comes from the cancer literature, and one chemotherapy medication called Cytoxan, or also known as cyclophosphamide, is sometimes used to treat severe lupus. Although the doses we use to treat lupus are lower than those used for cancer, we need to be aware of the potential problems that could affect fertility. These problems include lower levels of a male hormone called testosterone, lower sperm counts, and less sperm activity. All of these things could affect fertility in a man. Therefore, if this medication, cyclophosphamide, also known as Cytoxan, is being considered for use in a man, then this should be discussed with your physician, because there may be a possibility to freeze sperm and bank it. Finally, I would like to address the importance of having support when you have lupus, especially when you're a man. This might be particularly difficult for a man to get support from family, friends, or the workplace because they may feel that lupus is just a woman's disease. Therefore, it may be hard to get understanding about how lupus affects you and also how the treatments may affect you. For example, you might need work accommodations, or you might not even be able to work and would lose your benefits. The Lupus Foundation of America website has many resources to provide the support that you would need to try to address these problems.